ventilatory management, also known as the Combi-tube station, okay? And at this station, what you're gonna do is you're gonna be tasked with management of an adult patient without any possible trauma, so you don't have to worry about it. God bless how many people are videotaping, okay? There's no risk of trauma here, so we're not gonna worry about that. You'll be told that in the skill station. Come in, they'll give you the instruction set, you have a minute to look over your equipment, make sure that it's all there, and you're familiar with how to operate that equipment, okay? There's no suction out, guys. Guys, this other thing that should be out is at least a yonker, okay? All right, so you're gonna begin the station. What they're gonna tell you is that you have an adult patient that is apneic, okay? And this is the way that you'll do the skill station. You will stand at the head of the patient. You will open the airway with the head tilt chin lift, and sometimes you've got to hold these mannequins' heads back just a little bit, okay? The next thing you're going to do is you may select either a nasal or oropharyngeal airway. You need to make sure that you measure and demonstrate measuring, okay? And remember that it's from the middle of the mouth to the angle of the jaw for the oral airway, okay? I will now insert an oral airway, okay? Open with the cross finger technique, slide it in, make sure that it's there. I'm now immediately going to take my BVM, apply the BVM to the patient, watch what I do to make sure my head tilt chin lift maintains. I'll begin to ventilate the patient immediately. Breathe, okay? I'm going to briefly hyperventilate the patient because they were apneic, okay? I'm going to go ahead and have my partner hook them up to 15 liters O2, okay? If at any time at this point they tell you that you are not able to ventilate the patient, what is your first immediate action drill? Is to retilt the head and verify that your airway is in the proper place if you have an oral or nasopharyngeal airway. Okay? So you briefly hyperventilate the patient. They will now read to you the little thing where it says, you know, they will now notify, the examiner will notify you that you have adequate chest rise and equal bilateral breath sounds, et cetera, et cetera. Okay? All right? At that point, they're going to want to watch you ventilate the patient for 30 seconds. Okay? What is the correct respiratory rate for that?
10 to 12 minutes, 5, 6 seconds.
12 to 20.
Okay? Oh, yeah, no. 10 to 12 a minute is the correct ventilatory rate. Okay? All right? So you're talking about one breath every 5 to 6 seconds. Okay? If you're over significantly, you could fail the station. Okay? All right? So you're going to squeeze, and 2, and 3, and 4. And squeeze with one hand, and 2, and 3, and 4, and squeeze, and 2, and 3, and 4, and squeeze, and 2, and 3, and 4. Okay? If you make them know that you are paying attention to the rate that you are ventilating the patient, they're probably going to tell you to move on. And they're also probably not going to sit there with the watch going, are they really hitting it or not? Okay? All right? So after 30 seconds, they'll say, read the thing about medical control has now ordered you to place a dual lumen airway device. Right?
Okay. After 30 seconds, examiner auscultates and reports breath sounds.
Yeah.
Medical control is ordered dual lumen airway. Examiner now takes over ventilations.
Okay, so you will either, the examiner, or more likely what will happen is they'll tell you just, okay, I got it. Okay? At the point that you release and turn over ventilations, you are no longer responsible for what's going on with your patient at this point, okay? So they may bag for you, or they may just say, you're good, go on, okay? Put the bag down, okay? You now have got to prepare your equipment, okay? You take the Combi-tube, right? And we're going to have to check it. One is, we're going to have to make sure that we check both balloons, right? If you forget how much air goes in one of the balloons, read the thing, it'll tell you. Okay? The large balloon takes 100 milliliters. Okay? Here are techniques for those of you who may not have big hands or strong forearms or whatever else. Okay? Because this one's sometimes a little bit difficult. Okay? Go ahead and insert the catheter tip of the syringe into the balloon. Okay? Place the piston of the syringe up here on your hip or on your waist or on the belt. Push it in. See that it goes and holds. Pull it all the way back out. You need to. It's critical that you make sure that that goes back to the point where it dimples. Okay? See how it dimples? Then make sure that you leave 100 cc's of air in your syringe, okay? Number 2, 15 milliliters of air, okay? This one's a little bit easier to do. The distal balloon cuff is good. Pull it back down, make sure that it's dimpled. 15. I don't like to keep my syringes attached because you wind up dropping them and everything, okay? I'm gonna lubricate the tube distally, okay, which I've already done. And now I'm gonna hold it like a pencil, okay? I'm not doing this. I taught you guys this one, didn't I? You were here with me. We don't do this. This is gross motor skills. Dale did that. Those are gross motor skills. These are fine motor skills. This is how we hurt people. This is how we help people, okay? All right? The next thing you're gonna do is you're gonna advise whoever's doing the bagging or phantom partner or whatever to briefly hyperventilate the patient, okay? Or hyperoxygenate them, okay? Have them go ahead and remove the oral airway, okay? And to stand by. You will now use a cross finger scissor technique, okay? You will open the patient's airway and watch as I insert the Combi-tube in place, okay? I'm gonna feel my way in there. I'm gonna manipulate it and move it in there. Did you see me jab, jerk, do anything else like that? Okay, see fine motor skill? I'm going slow. You only have 30 seconds to interrupt ventilation, so I'm not worried about that now. Place it down as close as you can to in between your teeth. Some of these mannequins won't take it all away. They understand, okay? All right, and the next thing you're gonna do is you're gonna inflate cuff 1, okay? And this is where I'm trying to always maintain contact with that tube. I don't want it coming out accidentally, okay? I'm gonna go ahead and do cuff 1. And of course, using the appropriate amounts of air that I already pre-cycled. Notice my hands, see my hand technique, it's the same thing as I use with my BVM, right? This is the same thing I do with my BVM mask, this is the same thing I do with this tube, this is the same thing I do with the endotracheal tube. If somebody jars the patient right now, I'm not losing my tube, okay? That's a universal technique for everything, okay? All right, and then I'm gonna go ahead and I'm gonna have the examiner, or I can reach over. I don't like that little thing on top of that mask. Okay, I will now go ahead and hook it up to tube 1, okay? We're gonna ventilate the patient, and I'm gonna auscultate for lung sounds and epigastric sounds, okay? I'm gonna look for chest rise. The examiner will now notify you that you have positive epigastric, no lung sounds, and no chest rise, okay? When they say that, that means go ahead and move to tube 2, all right? And you're gonna repeat the same verification procedure, or you can direct them to do it with the stethoscope. You will get air in the stomach on tube 2, okay? But they're gonna tell you that you have equal bilateral chest rise and fall, that you have, positive lung sounds bilaterally, you have no sounds over the epigastric, okay? Good? All right, and they'll say you're good, and at this point you will secure the tube. A lot of times they're gonna skip this stuff because it's very time consuming, okay? But you can have them ventilate, or say I would have someone else ventilate the patient while I secure the tube. Does everybody know how to work a tube tamer device? If you don't, make sure you go through it. Critical fail is putting the bulbs and the leashes for the bulbs inside of it, okay?
Doesn't matter which direction it goes.
Doesn't matter,
Okay.
okay? Just depends on which side of the mouth you're gonna put it on, okay? Or if you're gonna do, a lot of people are gonna put them right in the middle. If you put it on, and this is something to keep in mind, if you put one of these things on and all of a sudden you can't ventilate your patient through a tube, what does that mean?
You can clamp
Can't
it too
clamp
tight.
it too tight.
No, and that's fairly common, okay? All right, and that's the station, all right?